Hi. Alright, so today is Wednesday, March 10th, 2010, and I don't know how long I've been on testosterone. It's over a year, about a year and like 2 months, I assume. Um, anyway, that's not what this video is about. So, what I want to talk about is information regarding how to transition, basically, and like what the different options are and resources for that, because of my last video I've been getting a lot of questions, and I think it would be good to have a video out there that just kind of tells you everything. So basically, the first thing you have to do, if you realize that you may be transgender, or that you know that you are, you need to see a gender therapist or a therapist that is okay with transgender issues. I'll put a link to a website over whatever side it's going to appear on, about that lists a lot of them, and that's actually how I found my my gender therapist. Actually, I found my gender therapist through the church that I went to, but she was also listed on that website, so you can find a lot of good ones there. Now, I went to therapy for about a year, 2 different therapists, one that didn't know anything about transgender problems, and one that was very good at it. So that experience of going for a year, I was about 16 years old, it was really beneficial to me, not just to go to get a letter, but I also brought my parents, and it was just a very, very educational experience, and for them, and it also helped me to know that taking hormones and possibly getting surgery was the right option, because there are people who are transgender who choose not to do hormones. They choose not to medically alter their bodies as part of their transitional stage, yet they identify as male or transgender, and that's how they live their lives. You don't have to take testosterone to be transgender or to be perceived as male in society, just so you know. But anyway, so once you go to therapy, if you're under 18, you're gonna need your parents' approval, most likely, for this. You're gonna have to decide if hormones are right for you, and if so, your therapist will hopefully at that point write you a letter to go to an endocrinologist, which is a hormone doctor. You'll set up an appointment with them. Sometimes they need blood work, sometimes they need other tests, but eventually you will get testosterone if that is what you want to do and you have the letter from your therapist. That's great. Once you go to therapy, they'll help you find an endocrinologist, so I don't really know how you find it. I just got recommended by my therapist. That should work out fine. There are also clinics. I don't know much about clinics, but I've heard of a few that are really successful in treating transgender folk and can help you out. So if you hear of a clinic for like gender dysphoria, or that is very gender oriented, and that's what you want to do, check it out, and I'm sure it will be fine. Anyway, so something that a lot of transgender people do is they bind. They compress their chest because they, have been born with certain female limitations, as I like to call them. They compress it in order so that it's not visible and that they can pass as male and feel more comfortable in their body. Or they compress it because they androgynous, like that's what they want to be. So the thing about that is that's just like how people feel comfortable. You don't have to. If you're very big chested, it might be very uncomfortable. Actually, it's going to be uncomfortable no matter what you do. Sweating is uncomfortable. Binding is uncomfortable. It's awful. That's the end of the story, but it is something that will make you feel better, possibly, if that's what you choose to do. And eventually, if you're getting chest surgery, it's definitely something you want to do if you're taking hormones and wanting to pass as male. I was very small-chested. I was very lucky, and I started out with an Underworks full-length double front binder, extra small. I was very small. I still am pretty small, but the problem with that I had with that is it compressed against like my hip bones, and I would get like sore there, and it wouldn't do it as much up here. So eventually, after about a year of dealing with that, I rolled it up. It was a double front. I rolled it up to here, then folded it down. So it was basically like the shape of the tri-top, which I don't know if you know what that is, but that's the one that I had, that I'm giving away. I already know who I'm giving it to, which is great. But so eventually, I would roll up. Eventually, I just got the tri-top because it's much more comfortable. It hurts under your armpits. Make sure you get the right size. Like they're very good about sending it back. One time I ordered extra small, they gave me an extra large. Very good about sending it back. So don't worry about that. If it doesn't fit right, just get a new one, because you don't want to be uncomfortable. It will be tight. It will be a little bit painful. But if it does the job, that's excellent. Alright, so that's binding. I'll give some resources for binding over on the side too. Now for packing, which is something that I was not interested in it at all. I've never ever done it before. I've never really like had the desire to or anything. And all of a sudden, I thought it would be very cool, or not very cool, but I thought it would be something to make me a little bit more comfortable. So I made that past video to enter this contest where a very, very kind and generous person who's very amazing is giving away a free binder or packer every week for 8 weeks. I'll put the link over there as well. And please check it out. If you're in need of a binder or a packer, go make a video response and like get yourself out there. She is doing a great thing, and it'd be a great opportunity, especially if you can't afford it. She'll mail it straight to you, or you can't like tell your parents or anything like that. It's a really great chance. So really go give that a try. I got a very kind offer from a very generous person who is actually going to be mailing me the things that I was looking for, and I'm very, very thankful for that. So I'll keep you posted on that. Should be interesting. But packing is basically where you use something else in order to make it look like you have something down there. I don't really know how else to say that in a not awkward way. Yeah, so basically, like, sometimes you need a harness to hold it in. There's this really cool website that sells like underwear that hold them in. They've got tons of different kinds. I'm putting a lot of links over there for different kinds that you can get. You can also make your own using hair gel and condoms. YouTube that. I'll try and find the video, but I mean, the YouTube little search thing is up here, and just search hair gel, condom, packer, or Google it, and you'll find it. So there's also, there's also Stp Devices. That is something that makes it so you can pee standing up. They have medicine spoons, you can pee straight out of those. They have travel mates, which are like for traveling. They're mainly directed towards women, but they help you pee standing up. You can pee on trees, you can do anything you want. Some guys really want to be able to pee standing up and they can't, and you know, I kind of actually really want to be able to pee standing up, so I may be getting an STP or finding a way to convert to an STP. There are a lot of videos about that too. I put some links for STPs over there. Alright, there's a few people who actually few trans guys who can pee standing up without any sort of help whatsoever, and that's a very magical thing that I don't know how to do, and I wish I did. But anyway, okay, so we've covered how to get testosterone, binders, and packers, and personally, I'm comfortable with my lower half of my region. Some guys are not. I completely understand why. I'm interested in exploring what it would be like to feel something like that. But it's not necessarily something that I feel like having a penis makes me a man. That's not at all how I feel. So I just want to put that out there. Like, some guys like have no desire to pack. Some guys like really need it to feel whole, and that is absolutely normal. That's perfectly okay. Everything's fine. All right. So last, if you get this far in your transition, if you start hormones, if you go to therapy, if you really want to transition, you can get, there's 2 different kinds. Well, there's like 3 different kinds of surgery, I guess you can get. So some guys actually get chest surgery without even doing hormones or any other part of the transition. It's all about your comfort level. It's all about what you want to do as you discover who you are. I got top surgery. I take testosterone, and I got top surgery about 2.5 months ago, and this is what it looks like. There's several different procedures. This is a double incision procedure. See, there's 2 incisions. Very nice. Where then they use skin grafts to bring your nipples up, because otherwise they would be like really awkward looking. So there is that option. That is what I got with Dr. Johnson. And there's a lot of different doctors all over the place that do lots of sort of different things. I've seen ones where your scars end up like this. There's a keyhole procedure that if you're very small chested, you can get, where they just cut around and just like take out all the fat there and put it back, and it looks great. There's no scars. It looks absolutely wonderful. Personally, I wish I could have gotten that one, but at the same time, I'm not worrying too much because scars will fade, and hopefully that will be good. So you can get top surgery if you want. You need to go to therapy, I think, before you do that, and get a recommendation for that. You also, you need to consider, like, if you want to take hormones before, after, or during, etc. There's also, you can get a hysterectomy, which is where they take out your female sex organs, I believe. I don't know if that, yeah, I'm pretty sure that's what it is. You can get that if you want to stop producing any estrogen. You do have to take testosterone, I think, for the rest of your life if you want to keep the changes going off of it. Things will start to shift and your body will get confused. You will continue producing estrogen if you're a trans guy, and that can get very messy. Just ask, and I'll try and clarify. All right.